us.
Yeah, definitely
For sure.
schooled us. So 7:31, and this week we will feature from the Guam Department of Education. She is, of course, the head nurse, Julietta Quinene. Good morning, Auntie Julietta.
Good morning, Chris and Sabrina.
Good morning. Thank you for coming on.
And
Oh, thank
we're so glad to have you here. As you guys have kind of been reactivated. I know that the GDOE nurses were helping out during the first lockdown, I believe, and now we've seen you guys get called up again. Maybe if you could, Julietta, tell us where the GDOE nurses are and how they're helping out in the fight against COVID-19.
yes, for sure. Of course, as you mentioned, the first wave between March and May, all our nurses were predominantly assigned to the public health areas. And under public health, we were helping Port Authority of Guam. We were helping the airport. At that time, it was still central region, northern region, and southern. So that's where our nurses were also assigned. And then we also had some nurses in the acute care setting, as in the hospitals, where they were also supporting. And even this time, when school just started and of course schools closed, again, our nurses went straight to help. Majority of them, approximately 32 right now, are helping public health. Again, in the different areas, as I mentioned, which could be the port, northern region, where they predominantly help with the swabbing and the assessment at that side. And then we also have nurses at the Guam Memorial Hospital as well, helping and supporting that side.
So, what are they doing at GMH?
So, remember, school nurses are a different specialization, right? So, where our job description and our skills are very closely to public health. So when we know that it could be a possible surge, that we need more nurses to engage in the acute care setting, we work with Lillian and we said, let's come up with a training schedule so that way our nurses could also be faced in with orientation, and that could ease, the anxiety and the scaredness, so they could get a feel back for what the acute care setting would be. Because majority of our nurses been in school nursing 10, 15, 20, and even more years. So they might not have that acute care skills that what would be needed to take care of for a critical ill patient or patient in med-surg that have other things that we don't have in the school, we don't have at the school side. So that's what they're predominantly doing. So approximately a 7-week orientation program where they're being mentored. They work, of course, at different shifts in the different units and, skills testing and things like that they have to do again as well.
Julietta, let's talk about because I'm just assuming that when you go from the school nurse setting, which is a whole different ball game, right? Checking for lice, a kid has a tummy ache, thrust into the front line of COVID-19, and I know that's why you guys train and that's why you're nurses. But what was one of the moments for you? Maybe you could share with us where you kind of took a look around and said, "Wow, I'm really in this fight against the coronavirus."
So again, as you just mentioned, all nurses receive the same basic education. If you do your BS and your Bachelor of Science of Nursing, right, whether you work hospital, public health, or in the school setting, we all complete that, right? Then you choose your specialization. You choose, would you like to work in the hospital? Would you like to work public health, prison, or whatever specialization? So it doesn't mean school nursing is less prepared to take care of other type of patient. It just means we all develop a different skill set because that is your love. That is what you choose to do, right? Definitely, specifically during March and May, we were asked as school nurses, let's go help set up. Remember, nothing was set up. COVID is new to everyone. We're going to go help at the airport. You help at the airport, nothing is set up. We kind of help develop the process, get that stabilized. Let's move on to the next area. The port, same thing, nothing is set up. What is the processes that we would like to have in place so that, we keep safety of everyone involved there? And then the same go with when they start opening the quarantine and isolation sites, I was the first one to greet our first positive patient. Again, nothing was set up. We start developing whatever the process should be so that we could safely take care of those patients at that time. So we real fast. I mean, this happened March 16, 17, right? When the executive order came out and the governor asked our superintendent, can the school nurses help? Immediately we start preparing.
Right.
Immediately we did our testing, which is needed so we can wear the N95 mask. Immediately our nurses decided, hey, which areas, I gave them 3 choices. I said, which areas do you feel most comfortable that you could be help and benefit our community as well? So those things immediately, right, start happening. And so when we came back to August, when it said, oh, guys, we need you to go and help again, it became almost a little easier because then the nurses knew what was expected. They knew what we did during the first wave. And this time it became a little easier. Also keep in mind, public health nurses, GMH nurses, they have their home base. We are not. We are DOE from the school setting. So we feel like visitors initially going to their home, learning their territory, but we embraced it because we knew this is our Guam, this is our community, and together we can do this. And we did that. And we're still embracing the fact that we're supporting.
But did you have any nurses that maybe were deployed to GMH and they were like, well, this is way too much for me. I didn't sign up for this, or or, you know what I mean? Because it is way different setting.
It is definitely a way different setting, but there's combination of factors too. It is not just, I'm not going to gym at quit, right? Remember, there's no daycare. Perhaps there's no one to take care of the elderly parent as well. So it wasn't just based upon I cannot or I don't want to help. It's combination of factors. And as of right now, our team is out there and do what they got to do.
Julietta, I got a message here from the Port General Manager, Ray Respicio. It puts, Chris, I see Julietta's on now. The GDOE nurses have been great operating the Port Clinic. Please ask her how much longer they'll be able to run the Port Clinic, as it has been instrumental in keeping the supply chain flowing. We broke 26,000 visits to the Port Clinic.
Yeah, of course, those are collective answers to that question, right? We are under PCO 1 right now, and the governor asked us as school nurses specifically to help during this stage when we are the pandemic condition of readiness. So if we go back to PCO 3, perhaps when school open, of course, that's totally dependent on the governor and the physician advisory team. And then our school nurses, of course, will migrate back to the school setting. But as of right now, based upon the governor's directive, we are out there supporting and helping until the island is in a better state where we can return to normality.
Are you still a DOE, or are you also out on the front line with at GMH?
Yes, I definitely support too. I predominantly support public health activities. I like being at the isolation unit. It's where we follow up with our positive patients. We call them after doctor review their charts and stuff. We'll release them. But yeah, if we look at our numbers, for instance, if I look at the last week, we have approximately 600 positive patients, right? Those are patients that have to be called every day to follow up how they are doing. Because keep in mind, the hospital have 40. Yeah. Public health have 600. So we have to ensure that 600 doesn't end up in the hospital, because there's no way our infrastructure can absorb 600. So what we are doing at public health is just as instrumental, right? I'm not saying what GMH is doing is not important, but that's why it is important to differentiate. There's different specialties in healthcare, and specifically nursing, and each one of us have a uniqueness to bring to the table. Like in this case with the 600, we keep on following up on them, and if we can start mitigating when things happening like, oh, I think you need to go, you start getting back closer to the hospital, this and that doesn't look good, but just that mere fact that the registered nurses can follow up on them make a huge difference. Right. And that is what could help keep those patients out of the hospital.
Right, and we've seen it with the call from the Nurses Association, all hands on deck, right? And so everybody is coming out. Can we talk a little bit about the Brotherhood, the Sisterhood that nurses have, from GDOE nurses to GMH nurses to public health nurses?
Sorry, I didn't understand your question, Chris.
Talk a little bit about the Brotherhood and the Sisterhood that we have between GDOE nurses, public health nurses, and GMH nurses.
Yeah, again, as I said, a nurse is a nurse, as they would say, right? We all have the same goal in mind. We all have the same training. We all bring, it's almost you look at a circle or a square, and you take a piece out and you put it together as a puzzle again, they all fit in because we all have a responsibility to add to make it whole again. And when I go to public health and health there, I don't look at myself as a DOE nurse just coming to help. You feel that we're all in this together. We want to get these numbers down. We want to make sure we're back to normalcy again. And that's kind of unique what a pandemic can do, right? Because normally GMH is out there on their own, public health is out there on their own, GDOE is out there on their own. But this pandemic brings us actually closer. We communicate more. We could see what else could we implement that could, make things better in the processes that we're trying to do and apply.
Julietta, we're going to wrap up. Before we go, you mentioned that you are at the ISO facility. So what would in closing, your message to the public, because you're seeing these people who catch the COVID-19 and maybe for whatever reason, economically, right, they can't stay at their house because they don't have a room with a separate bathroom. And so they got to go up and out of their home environment and go to this facility. So what are some of the things that maybe they say to you, and what would you then unpack to the public?
Well, a combination of factors, of course, family differences, as you mentioned, that sometimes it's a small house, only one bedroom, right? I mean, one bedroom, one bathroom, so that person cannot be there, or the person is the breadwinner. If that person cannot work, they're not going to get finances. So what I like about public health approach too, we also have social workers there. So if there's any social issues that come up, to see what other support they might need. For instance, as I said, we don't have food or we don't have medication. I don't have a car. I'm running a fever. I don't have any medication. Those are things too where public health could see what other support we could have, because the social workers could go get the medicine if it was prescribed, pick it up, take it to the family, pick up the groceries, take it to the family. So it's more than just saying stay home and you're out on your own. The public health team really planned it so that they can also embrace them and see what more can we do to help them so they can be safely at home.
I just wanted to ask before we let you go, if there, say there is a young girl or male out there that might be listening or watching that might have an interest in a career in nursing, what would your message be to them?
Oh, believe me, I would love for them to really consider it, because one of our cornerstone of nursing is caring, right? To take care, to nurture. And during your training, you will get all of that. And nursing, as they used to say, it's not just about washing the patient, it's more, it's a science. It makes you more engaged from prevention side, all the way till geriatrics, the old age, when you're getting them ready to pass on to the next life, right? So depending what you like in life, I always ask our students, what do you like? Do you prefer talking to people? Do you prefer talking to computers? To kind of get them a sense to where they want to head to, because nursing is so unique. It has almost 200 specializations. So totally depending on what your needs, what you like, right? We can find something for you to do, whether you like little kids, babies, whether you like older people, whether you like sports medicine, whether you like, as I said, perhaps working with the old and the frail people. Those are all options. But keep in mind, we need grades and we need to graduate, right? Want to make sure that when we apply to university, that's what we're going to do. forward, set your goal for 4 year BSN course, and you can do it. Always tell yourself if someone else could have done it, doesn't matter what circumstances what's around that person, that you can do it as well.
Right. So why did you decide that you want to be a nurse?
I grew up in South Africa, and for me during that time, there wasn't a lot of options. We just came out of the apartheid era, and there were certain options that they really needed help in, for instance, teaching and nursing, and we had great scholarships. So initially you started off with, okay, I'll try that, but I can tell you right now, after 30 years, I love it. This is my life. I've done it longer than being married or having my kids, because it's the joy that you see when you could help one person, right? Even if it's a 5-year-old diabetic student at school, at the end of that school year, he come to you so proudly and he can show you what you have taught him and how he knows how to better manage his disease. Is seeing that a young girl will tell you, no, man, I'm going to go to school. I'm going to finish school first. I'm not going to get pregnant. I'm going to do this. This is my goal. This is my direction in life. Thomas, I don't want that sugary drink no more. I turn the bottle around. Oh my gosh, it has so many sugars. It's those little things, those little influences that we can make as school nurses. Keep in mind, we have 28,000 students and 4,000 employees. So we have a magnitude of people that we can deliver health information to, the preventative side. And preventative is cheaper than cure. Of course, it's a fine balance, right? But prevention has always been cheaper than curing the disease at the end.
And you guys are in a good place, Julietta, as you have the young minds, like you just described, those instances where the kids are looking at that label and finding out, oh my God, there's 28 grams of sugar in this thing. Is that what keeps you going? Because in being a nurse on this island, being a medical professional, a doctor on this island, we're underserved, right? This is an underserved area. So do those little victories keep you going? And do you ever have those moments where, and because I've talked to other nurses and doctors who do have those moments where they're like, God, we're in over our heads. It's tough.
It feels like that occasionally, right? But it doesn't last long, because tomorrow is a new day. I believe what Nelson Mandela said. I always say it's my tata. You either win or you learn. There's no losers in this game. You win or you learn. So if it didn't go according to you, let's go back to the drawing block, right? And see what do we need to change to make that difference. As I said, in the school setting, it might sound like individual cases, but no, we're looking collectively at 28,000 kids. For instance, the 2014 BMI data, right? It was just out of whack. We were so high. If I proudly look at it right now, 18 schools are under the national average. So there are little things, there are improvements, what we are doing that the people outside of the school setting not aware of, right? Last year we won the National School Nurse Data Collection, because we've shown the National School Nurse Association, what does Guam do when we collect data? For instance, the BMI data, we use that, free and reduced meals, right? That we've got. We work with public health. We've got funding to buy more scales to keep on weighing our kids. We got funding for vision screening. Of course, not all parents can afford to just go and get their kids' glasses and eyes tested. We're working with nonprofits to get those kind of stuff going, right? And there's so much more. And I know our time won't include me to keep going on and on.
I know Bree just gave me the don't ask her any more questions look.
No, I gave you the wow, she's a rock star
Yeah,
look.
you're rocking it.
There's so much more that we do as school nurses that I feel our community is not aware of. So it is important that they know that your school nurse is an anchor, because if for whatever reason, if the school nurse is not present in that school, that principal will immediately say, oh, right, everything comes to me. Everyone feels confident and comfortable when the school nurse is present, because we don't just take care of the chronic conditions. We have to take care immediately if there's any first aid and CPR. And don't for a minute think we don't do CPR in school. Yes, we do. So we have to be ready and prepared. someone mentioned to me that a school nurse is almost like an ER nurse because for one moment I could, for instance, say, "Hey, let's do your height and weight," and all of a sudden, someone come in there with a gushing wound. So you have to prioritize so quick and making sure that little one is taken care of, whether it's a 911 call. In the meantime, like in the clinic or at the hospital, right? You have a team of healthcare professionals there. You have a team of nurses there. In the school setting, you only have that RN at that school. And she has to do whatever she needs to do to make sure, we don't lose a life, God forbid. And she has to make sure everything works out the way it should until we wait for the ambulance or until we wait for that parent to come and pick up that kid.
All right.
Well,
Thanks, Juliet.
Yeah, thanks. Right on. Thanks, Auntie Julietta.
And thank you for always bringing us the latest and updated news to the island of Guam. Totally appreciate it as well.
Thank you so much. Be safe and wash your hands and keep up the great work.
Yeah.
Definitely. You guys too. Keep safe out there.
All right.
Thank you, Auntie Julietta. Okay, Esther. All right. Hey, we're going to sanitize the KUM News Zoom room.
Right. That was, again, that was Network of Nurses. It's our partnership with the Guam Nurses Association, which was incorporated in 1951 and has been a constituent member of the American Nurses Association since 1968. And I wanted to give a special shout out to Suzanne Lobaton. She's the vice president of the GNA, who has been working with us to make sure that our nurses on Guam get the love that they deserve. So
Amen.
Thank you, GNA.
Right, and just full disclosure, Julietta is my auntie. She's married to my mom's first cousin, Uncle Tony. 7:53. We'll take a short break. Come back with Canada.